And in South Africa, Health Minister Joe Phaahla said on Friday that a preliminary study suggests a new COVID-19 variant detected in his country may be more transmissible, but the decision of other countries to impose travel restrictions is unjustified. Phaahla, at a media briefing, said South Africa was acting with transparency and that travel bans contravened the norms and standards of the World Health Organization. South African hospitals and health facilities are on high alert since the new variant was announced on Thursday, as CGTN's Julie Shire reports.
There's little known about the new COVID-19 variant B11529, which has caught scientists in South Africa by surprise.
There seems to be more than 50 mutations compared to the original virus, and more than 30 of these are in the area of the virus that we are concerned about. That is the area that interacts with the human cells that causes infection. And also that is the area of the virus that vaccines, for example, may target. And so if those areas have changed, vaccines may not work as well as they would have worked before.
The new strain is spreading rapidly. Close to 24 cases have been detected, most of them in the Gauteng province.
I'm very worried about the new variant, and I'm not sure if we're going to survive this one this time around. It's very stressful because now we have stopped attending classes. Like we had contact classes, but we are no longer attending. And we cannot go home as well.
It makes me feel so sad, so frustrated, so anxious, because I feel like everything is just stopping my future, stopping everything, everybody's future.
Travel to and from South Africa has been banned by several European countries. The United Kingdom had only recently removed South Africa from its red list after the third wave subsided in October.
There is no country which would want to have a new variant. And we fully understand when countries ban South Africa. Obviously, bad news for us because it's just before the festive season and people have booked their tickets to come here. And there is not enough domestic tourists to cover the entire tourism value chain.
President Cyril Ramaphosa will, with his command council on Sunday, decide the way forward. Another strict lockdown will hurt the economy and worsen a staggering 35% unemployment rate.
We might actually get a situation where the borders might be closed. The internal borders within South Africa might be closed because of trying to stop the spread of this new variant. Obviously, it's unfortunate, but I think the most important thing is that South Africa comes first before tourism comes first.
It's unclear for now if this new variant may cause a more severe strain than Beta and Delta that drove South Africa's second and third waves. Hospitals are, however, preparing for the worst. For South Africans traveling home, it could mean another bleak Christmas if restrictions are tightened and plans have to be put on hold. Julie Shire, CGTN, Cape Town, South Africa.
Well, I'm now joined by Professor Marta Nunes from Wits University and a senior researcher at the Vaccines and Infectious Diseases Analytics Research Unit in South Africa. Thank you very much, Professor, for joining us. What do we know about this new variant, Omicron?
Thank you so much for inviting me. And yeah, these are really very early stages of the discovery of these variants. So we really don't know much. What we know more is about the genome of these variant, and we know that has quite a lot of mutations compared to the original virus from Wuhan. So that's really what we know, that has more mutations than the previous variants that were identified. And then we are really trying to gather more data on disease presentation, on disease severity, if the symptoms are different from the previous variants, but that's really still ongoing. And like I said, it's very, very early ages, so it's good to be alert. It's good to know that there is this new variant, and a lot of research is still going on. So the next few days will really be decisive to understand the potential of this new variant.
So there's still a lot of research going on, but after more than 2 years of COVID-19, why are we still not seemingly adequately prepared to deal with emerging and new variants?
Well, I think it's on the contrary. I think for us to detect such a variant in such a short time, that tells us that a lot has been evolving, that now we detected this variant in a few days since has been circulating. So I think it's really a lot of progress from the last 2 years. I think people does feel probably frustrated that we are still seeing new variants arising and the virus is still circulating, but we are really still learning we are learning a lot from this virus. But I think the way that this new variant was identified and and all the world came to know this new variant was again in record time. So I think this does tell us that the surveillance that's going on in the different countries, including South Africa, it is working.
All right, Professor Marta Nunes joining us from South Africa. Thank you.